Dr. Clem, thank you so much for joining us here on Health Connection. Our topic is the flu, children and the flu, and the title is Calling the Shots. So I like to start these segments as often as I can with a definition. What is the flu and how is it different from the common cold?
Good question. The flu is a respiratory illness that is either caused by influenza A or influenza B. It is pretty similar to the common cold, but it is also different in the sense that it can be more dangerous. So the influenza virus can actually cause a lot more morbidity and mortality. So children can get sicker from just the regular influenza virus, and children can often end up in the hospital, and some children even die every year from the flu.
Okay. How does the flu get around? How is it transmitted from person to person?
So the influenza virus is spread from person to person. It's often spread from children touching their hands, sneezing, coughing into their hands, and then touching something else, and then someone else comes and touches that, and then touches their own face, nose, eyes, or mouth, and those droplets get into the other person and cause infection. It's also just spread from droplets. So if somebody sneezes or coughs in your vicinity, and then those droplets can directly go into your own nose, eyes, or mouth and cause the influenza virus in you.
So direct contact and aerosol?
Yes, sir.
Okay, all right. Are children more susceptible to catching the flu, and if so, why?
That's a great question. So children, there are some studies that show children are more susceptible at catching the influenza. There's thoughts that it's due to the decreased immunity that children have at times. So children, as you can imagine, young children, they just haven't developed their immune system fully. So that could put them at higher risk for getting the flu. There's also thought that the virus replicates in the respiratory tract faster and more aggressively in young children, and it takes longer to clear that virus from the respiratory tract. In addition, children are much more susceptible to complications from the flu, and that's the key is these complications from the flu that can occur.
All right. Are flu symptoms different in children than they are in adults?
Yeah, so most children have pretty similar symptoms. The one thing that is very different is children are more likely than adults to have the vomiting, nausea, or diarrhea associated with the flu. Most adults don't get those symptoms typically, but children might. The other symptoms are fever, which they can have very high fever. So a child can have a fever up to 104 or higher, which can often be scary for parents. They have the stuffy nose or runny nose, congestion, sore throat, a lot of muscle or body aches, and just generally really tired. In babies, they can often present a little differently, and you might not even know they have the flu. Sometimes babies can present with low temperatures instead of the high temperature. They can just present with being lethargic, or you can't wake them up, and babies can sometimes just stop feeding or have just fast breathing or even stop breathing. So they are a little different than adults.
I think every parent has come to accept that they're going to see runny noses, and it's just part of having children in the house. But at what point do you start saying, this is more than a common cold? Where do you start saying, uh-oh, we might have the flu?
So that's a great question. It can be really hard to decipher, even for medical professionals, whether it is the flu or just another cold virus. One thing different than with the flu is oftentimes it's just a really rapid onset. So just all of a sudden their child spikes to 104 fever. Generally you see a little more kind of achiness with the flu virus than other viruses, and just kind of that rapid onset of illness. But again, sometimes it's really hard to determine whether it's the flu or another virus.
Is there a definitive clinical diagnostic test for the flu, or is it diagnosed symptomatically?
So that's another great question. If if you suspect your child has a flu, your doctor can sometimes do a rapid flu test. The one thing with those tests is they're not 100% accurate. So what that means is sometimes a child or an adult might have the flu, but this test says that they don't. And so that is a false negative test. And oftentimes what we'll do is just go on, your doctor may decide to test you or not test you, but sometimes we just diagnose based on our clinical skills and your provider's best judgment.
Okay. Kids pass disease back and forth among each other. The practical way to avoid passing the flu is just keep kids out of contact. But that's not actually practical in the real world. So in terms of preventing flu transmission as a practical matter, raising kids that have to go to school and be in contact, what can you do?
The most important thing you can do is vaccinate your child and vaccinate everybody in the household. That is proven to be the most effective way at preventing the spread of the flu. Apart from vaccinating, you want to really encourage your child to cough or sneeze into a tissue or at least their sleeve. You want them to avoid coughing or sneezing into their hands. You want to throw any tissues away that have been used right away because they'll harbor the flu virus. You don't want to share drinks or toothbrushes or anything like that. And then you want really good hand washing is one of the keys to prevent the spread of illness, and disinfecting surfaces that are commonly contaminated with the flu virus, such as kitchen counters or doorknobs, things like that.
You mentioned the flu virus. Segue into our next question. When should children start getting the flu vaccine?
Great question. So children over 6 months of age can get the flu vaccine, and you want to get the flu vaccine as soon as it is available in your community. The purpose of the flu vaccine, you want to get it, and it works better when you get it before influenza actually invades your community. So it does take a couple of weeks for your body to build antibodies to the flu virus. And so the sooner you get it, the better. Usually that's around October, and it's a good idea to be vaccinated usually around between October and mid-November, but the sooner the better. But just because you haven't gotten vaccinated early doesn't mean you still won't benefit from getting the flu vaccine.
Okay, a little bit of immunology here. Why do we have to get a shot every year?
Well, the flu virus replicates. So every year there's a slightly different strain of influenza. And so you have the experts that are in the lab studying the strains, and they do their best guess at what the virus's strain is going to be like for the upcoming season, and that's how they make the vaccine. And so from year to year, the vaccine strains are usually a little bit different, sometimes very slightly different, and sometimes more significantly different. And your immunity usually wanes at about a year after the vaccine is given. So that's why it's really important to get revaccinated every year.
All right. We used to do the flu mist. Why is it no longer recommended?
Great question. So many parents have that question. They loved the fact that their child didn't have to get a shot. Unfortunately, after several studies, they've shown that the flu mist is actually not very effective for the specific flu strain H1N1. And so that's a common influenza virus that is usually found from year to year. And so since it's not very effective, they decided not to offer that vaccine this year as well as last year. So they've continued to say, you know what, this is not effective, it didn't work, so let's give children and people something that works.
All right. Earlier you mentioned the kind of the red flag flu symptoms where you say, oh, this may be more than a cold, this is the flu. Parents start seeing those symptoms. What should the parents do? Just kind of walk us through the steps.
Okay. So if you think your child has the flu virus, you can contact your healthcare provider, especially if your child might be high risk or there's somebody in the household who might be high risk for complications. There are antiviral medications that we use to treat flu, but those antiviral medications are best used and only recommended in the outpatient setting when given within 48 hours of onset of symptoms. And so if you think your child has a flu, you should contact your provider, and you guys can discuss whether it's something your child should be seen for, or they feel like it's okay to care for your child at home. Things you can do at home are treat the fever or discomfort symptomatically. So if your child is old enough, they can have ibuprofen or acetaminophen. Talk to your healthcare provider about appropriate dosing, or if it's safe to give your child that medicine. That helps with discomfort that can be associated with the flu, both the achiness or fever. You can also use a humidifier or vaporizer in the room. That can help soothe the airway a little bit. In children greater than 1 year of age, it's okay to offer honey as a way to help soothe the cough. Cough or cold medicines are not recommended for any children under 6 years of age, as those have led to actual fatal overdoses. So you want to avoid cough and cold medicine in children. And for little children, and even older children, you can use saline drops in the nose, and that really helps loosen up any kind of congestion. And then lastly, you want to make sure your child gets plenty of rest and stays well hydrated. If your child doesn't eat, that's okay, but you want to make sure they're drinking.
Let's amplify on the hydration, on the drinking water. Why is that important?
Well, it's important to stay hydrated, because that can be one of the complications. A child sometimes, just refuses to drink and they're not peeing, and so children actually can be admitted to the hospital just to manage that. If someone gets dehydrated, it can affect their electrolytes in their kidneys. So you want to make sure they're drinking enough fluids. You want to be sure your child is making at least 3 wet diapers a day. So about every 8 hours, they should have a minimum of 1 wet diaper. And in babies, you want to make sure they have just tears in their eyes and just their mouth is really moist, and that they're responsive to you, that they're not just laying there and you can't wake them up or arouse them.
Okay, and for an older child, how much water do you want to see them drinking?
So it varies by the child's age and weight. I would recommend just pushing fluids as much as possible and really keeping out, there's not necessarily one magic number for everybody, but at least, an older child and an adolescent ought to be able to drink at least 1 liter a day, and at the bare minimum, and younger than that, the school age years ought to be drinking at least 10-12 ounces minimum. And the key is to watch those the urine output. That's a good way to tell that your child has just the minimum hydration that's needed.
Okie dokie. So now, but yet we have the flu. We've got a child who's sick with the flu. How long is it going to take to run its course?
So the typical course is between 7 to 14 days. So the flu is not just usually a really quick virus that you get and then you're done with the next day. Some people do have milder forms, and so it may last a couple days, but it's not uncommon, and especially in children, to see really high fever for a good solid 5 days with the flu. Again, things to look out for to be worrisome are, if your child isn't drinking, if you can't wake your child up, if they're just laying there, if they're having any kind of trouble breathing, or if the fever persists for much longer. You want to seek help to make sure that there is no secondary complication from the flu that your child's developed.
Very well, doctor. Very informative, and we thank you.
Thank you. Thank you for having me.